Hello guys, I am Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about benign inflammatory lesions of larynx. Okay, there are so many conditions. We'll learn each. Okay, the first one is contact ulcer or pachydermal laryngitis. Pachydermal laryngitis or kissing ulcer. Here the cause is excessive voice abuse. Excessive voice abuse, like in mimicry artist or those who do these things, and due to reflux. Okay, it is not a true ulcer. The first thing that you need to know, it is not a true ulcer. Contact ulcer, it is not a true ulcer. This is a pseudo ulcer. There is no breach in the epithelium. Okay, it is just due to the indentation of the opposite hypertrophied arytenoid on the opposite side. Okay, so if there is one side arytenoid is hypertrophied and the other side it is not hypertrophied, this will rub on each other and this will cause a pseudo ulcer. Okay, so this is due to rubbing on each other of the retinoid. Okay, posterior larynx is involved. The differential diagnosis is tuberculosis and carcinoma. On histopathic examination, we'll find hyperkeratosis and acanthosis. Hyperkeratosis and acanthosis. This is not a pre-malignant condition and it will not progress to malignancy. Simple. The treatment is voice rest, anti-reflux, and laser excision. So this was about contact ulcer, also known as pachydermal laryngitis or kissing ulcer. That was due to hypertrophied arytenoid of one side that is indenting or rubbing on the other side. Okay, so this was about contact ulcer. Coming to the second entity, we have keratosis larynx. Keratosis larynx, or also known as leukoplakia, and this happens because of chronic irritation. It will happen. So the cause is mainly smoking. Smoking is the cause of keratosis larynx. Tobacco chewing, occupational fumes, alcohol abuse, chronic reflux, and excessive voice abuse also again. So differential diagnosis is, since it is leukoplakia, we can differentiate like diagnosis as candidiasis and carcinoma. It is a pre-malignant lesion. Okay, it is a pre-malignant lesion, and the treatment is excisional biopsy and stripping of the vocal cord. Okay, so this was about the keratosis larynx. Now let's learn about Rinke's edema. What is Rinke's space? So Rinke's space is a subepithelial space. Now our vocal cord has four layers. The first one is epithelium, then we have superficial lamina propria, and in between these epithelium and superficial lamina propria there is a space, and this space is known as Rinke's space. Okay, and after the third layer is vocal ligament and vocalis muscle. Okay, so the space between epithelium and the superficial lamina propria layer of vocal cord is known as Rinke's space. So accumulation of edematous tissue or myxomatous tissue in this space. Okay, so this is called Rinke's edema. The cause is chronic irritation, that is due to smoking, tobacco chewing, voice abuse, and reflux, and sometimes hormonal disbalance also, like hypothyroidism and hypoadrenalism also. Okay, so what will happen here? The anterior two-third, suppose this is the vocal cord, so only the anterior two-third, that is membranous part, is involved. Okay, so anterior two-third or membranous portion of vocal cord is involved. Okay, and the clinical feature, they complains of diplophonia, that is change in voice, and bilateral symmetrical fusiform swelling. How come? Bilateral symmetrical fusiform swelling, because only the membranous part is involved. Okay, so this will fuse like this. Bilateral symmetrical fusiform swelling, that is also having bag of water appearance. Okay, this is a bag of water appearance. Okay, so what is the treatment? Stripping of vocal cords. Because this is a chronic condition, because the chronic pathology is there, the medical therapy is not that much effective. So this was about the Rinke's edema. So till now we have learned about contact ulcer, then we have learned about keratosis larynx, then we have learned about Rinke's edema. Thank you so much.